Well, I'm going to go ahead and chair this meeting. Unfortunately, Supervisor Gomez wasn't able to be present with us. So I believe everybody knows me, but I'm Barb Lang. I'm the Director of Public Health for Cochise County, and we have some great information today that hopefully you'll be interested in. Lots of things happening in the county, lots of good things. And so wanted to share those things with you today. But before I roll into all of that information, we do have 3 board vacancies. We have one in District 2, which of course we've got Douglas, Wilcox, Elfrida, Purteville. We have a vacancy in that area. I know folks from Chiricahua have expressed interest in filling that vacancy. We have a vacancy in the Wilcox area. So I'm not sure if somebody from Northwest Hospital is interested in filling Mo's position. Mo has moved on to another role outside of the state. And then we have another vacancy in the Benson area. So I don't know if maybe somebody from Benson Hospital, Jason, or somebody else might be interested in filling that role. So once Supervisor Gomez takes her chair position, we'll talk about voting who should fill those seats. I think we've got a great group of folks thus far, and hopefully everybody's committed to continuing with the board, and we'll go from there.
Yeah, do you have a need from anybody in Bisbee?
Yeah, Bisbee is District 2, so definitely.
Well, I'm gonna suggest a name to you.
Okay.
I'll send you the contact, but a fellow named Joe Delgado.
Joe Delgado.
He just finished up a 12-year term on the Legacy Foundation board. And
I think I've met Joe, Lonnie. I think I've met him. Okay.
Yeah, he used to be on the school board there in Bisbee and so forth. So if you'd like, I'll send you his contact information.
Yeah, that'd be great. Thank you.
Okay.
Yeah, that sounds good. So first line of business, everybody should have received a copy electronically of the annual report. If you didn't, we can have you receive that. And the bottom line for this annual report is this is chock filled with all the good stuff we've done over the course of the year. I'm going to just review some of the highlights, and if anybody has any questions, feel free to interrupt or stop me. But from a high level, the bottom line is everything's gone up. Everything's gone up. Indigent burials, when people can't otherwise afford burying a loved one, the amount of people we paid for indigent burials has gone up. There are a few things that have gone down, but I'm going to talk about what's increased during this time. Rabies has gone up, and you're going to see a presentation about rabies. But just to give you an idea, over the whole course of 2024, there were 15 cases of rabies. We're just starting March, and we're already at 8 cases. So that just shows you how fast rabies is moving through Cochise County, which of course is a significant concern because we're a beautiful nature preserve area and we've got lots of hikers out there and we want to make sure that people are safe. So our prevention area is going to speak to rabies. Other things that have gone up is we have distributed over 9,000 doses of Narcan. That's 9,000 times people's lives have been saved. So Narcan is that chemical in the nasal spray that fights the effects of using opiates. So OxyContin, heroin, benzodiazepines, all those drugs that can cause a fentanyl, a fatal high, Narcan can block those effects. Until a medical professional can get there and treat them. Let's see, home visits for Health Start education, support, and advocacy. We've gone up considerably. Over 3,000 home visits where people have had supportive connections for their children. We've talked to them about nutrition, parenting. That has gone up. WIC participation has gone up significantly, and we've introduced WIC Your Way. So that's the Women, Infant, and Children program to get nutrition out to folks. WIC Your Way is an online program where they can get that information in the comfort of their home. Health promotion has gone up. We've held classes regarding brain health, tobacco prevention and cessation, dating violence, worksite wellness, chronic disease prevention, teen pregnancy prevention. And we also received the Platinum Award from the state for our wellness programs, which is exceptional. So some of the things that have gone down, unfortunately, money. Money to support the department has gone down. A lot of the grants are coming to an end. And with some of the changes for federal government funding and so forth, we're seeing that money not replenished. So we're really having to pivot and move money around between departments and figure out how we're going to cover certain services. Title 36. So involuntary treatment for persons that are struggling with mental health disorders, we're seeing that going way down, which is really good. A lot more people are choosing to voluntarily get treatment, which is great. And recently we had 2 beds open up in Sierra Vista for people for stabilization at La Frontera, which is great. And anybody in Cochise County can be transported there. And that's a wonderful thing because rather than going to jail, if they're struggling with substance use, they can use one of those 2 beds. La Frontera has committed to increasing the number of those beds if the supply and demand is there. So that's really good news for our county. We have TB testing and treatment and screening. A lot of folks don't know. We only charge $25 for that. So we're seeing that increase. We're seeing a lot more employers requiring TB screening. And because we only charge $25, people are coming in and taking advantages of those services. We are seeing COVID drop in Cochise County, which is a good thing, but we're seeing a lot more respiratory illnesses. So really important to make sure you're protected and getting vaccinated. And so we've been posting a lot on social media, the importance of vaccine. We are seeing people come in and get vaccinated, but we still want to work on increasing those rates. We've been doing a lot of classes at the schools through approved curriculum. So we just have a lot of great stuff going on. From emergency preparedness standpoint, our department has really stood up our coordination site. So we've got lots of great equipment that's going in there so that we're prepared in the event Cochise County has an emergency, that we have a whole site set up and ready to operate from that standpoint. So lots of wonderful things. I hope you'll take the time to read the annual report. It has all the numbers in there, and I think you'll be surprised at exactly how many services we're providing. And we're a very small but mighty team. We do a lot with not a lot. So I'm very proud of that. And I hope you'll take the time to review those pages.
Very good.
I don't want to forget Natalie, my Director of Environmental Health, is on there. So that's also in the annual report. Lots of health and safety classes regarding new businesses that are coming upon us, restaurants, things of that nature. With the cottage bill, people being allowed to make food from home. We are seeing some complaints, foodborne illness. So Natalie's team tackles that and also does education and technical assistance. And of course, our detention team. Our correctional health facility is seeing a lot more people that are struggling with substance use and mental health. So really working with those inmates to make sure that they're provided dignity and respect while they're incarcerated and that they're getting the medication and treatment that they deserve. So, all right. So from there, we're going to move over to rabies. Wait, sorry.
Brief moment while we get it up.
Yeah, sorry. There we go.
Can you guys see the screen okay?
Yeah, it's great.
Okay, perfect.
Good morning and welcome. My name is Kimberly Mitchell. I'm the Cochise County Health and Social Services Public Health Preparedness Coordinator. And today over here, we also have Cochise County Health and Social Services epidemiologist for the county as well. Yes. All right, so I'm going to give you a brief and high-level overview of rabies, and then we're going to get into some of the data with it. So rabies is very much a preventable viral disease that affects mammals, usually transmitted through the bite of an infected animal. Each year, cases are reported in both domestic and wild animals. However, once the symptoms start to appear, rabies is 100% fatal. And that's really what we want to hone in with everybody. All of this highlights the importance of prevention through early vaccinations, starting with your animals, and then early interventions, starting with public health, local law enforcement, and our hospitals. So I want to get into a couple of things. There's a lot of confusion about what is an exposure, what is not an exposure. So according to Arizona Department of Health Services, rabies exposures can be defined in two ways, either a bite or a non-bite. I really feel that bite speaks to itself. It is definitely a wound from a tooth that penetrates the skin, but a non-bite can be a little bit confusing. So it has to be an open wound either in the eyes, nose, mouth, or a scratch, so something on your hand that has contact with saliva, brain tissue, or that cerebral spinal fluid. And down here at the red, I know it's like hitting you guys hard right here, but we want to make sure that you guys we get the point through that it's any bite or scratch or other incident in which saliva, brain tissue, or cerebral spinal fluid comes in contact with those open wounds. And we go through a little process with that, and when we talk to our victims, we kind of run through those processes with them and have that discussion. So let's go into what is a non-exposure, okay? So petting or touching the body fur of a potentially rabid animal, touching an object that potentially rabid animal had, having contact with urine or feces, and then being sprayed by a skunk. That's a big one. A lot of people are like, well, I was sprayed. It is considered a non-exposure. But I do really want to hone in on those 4 big bullet points right there that we strongly, strongly advise against touching any potentially rabid animal or contaminated items with bare hands. If you must move the animal for whatever reason, we ask that you do handle with either gloves or a tool, so like a shovel and such, and then wait for local law enforcement or animal control to come get that sample. So we just really want to hone that in. The other exception is the bat. And I'll speak a little bit to that when we go into some tables that you guys can see. But being in the vicinity of a rabid animal, with the exception of the bat, is a big one for us. We have a lot of discussion with healthcare, being hospitals and animal control and such on that, and what is an exposure and non-exposure with that. So real quick, recognizing some symptoms of rabies in animals. So rabid animals often show unusual behavior, so wild animals may lose their feeling of fear of humans, right? As you can see, this fox right here, he is one of the rabid foxes that actually had contact with one of our victims. He does look sickly, does he not? He kind of has those droopy eyes. He kind of looks like he has some neurological things going on. That animal should not be staring at you in the wild, okay? That's just, it shouldn't. They should have that fear of humans. So with your home pets, domestic animals, sometimes they can become a little bit more aggressive, right? Because they're normally friendly to you. So some signs right here in behavioral and physical change, you're going to see some excessive drooling, difficulty walking, disorientation, unprovoked aggression, where they normally shouldn't have any contact with you. Another big one is any nocturnal animals that may appear during the day. That's a big kicker, okay? You shouldn't see them out. They shouldn't be out during the day. That is a huge recognizing that they're out there. So if you see an animal acting strangely, avoid contact and report it to local law enforcement immediately, because rabies is deadly, but the awareness and quick action can save lives here. So let's speak to a little bit of immediate actions. Oh, is there a question?
Oh,
I can't
yes.
see. Oh,
I wanted to hear more about the rabid foxes and where they have been seen. And I also have a question about leaving water out at night. If a rabid animal came and drank that water and then a pet drank that water, that's not an exposure, is it?
no, we've had that conversation with our USDA wildlife officer. That is not. I do know a lot of people leave water out for wild animals. Do realize that that brings animals in, and right now we're in a droughty season. So the least you can leave out for a wild animal to have interaction with humans or your domestic pets is the smartest action that we can do. So it keeps you safe, it keeps your domestic animals safe. But yeah, we suggest dumping out the water and try not to feed any wildlife where they can actually all come together and have their little powers.
I don't feed them. I don't feed them. This was just out
good.
for, the dog or anyone.
Yeah.
But I better pick it up at night now, huh?
Yeah, or just flip it over and then give it and then fill it up in the morning. And then I'll speak to those locations a little bit later in the slide for you.
Okay, great. Thank you.
Perfect. So immediate actions after a bite is, I know this one's a little bit hard because a lot of our interaction with those rabid animals are out in like the forest areas when people are hiking and stuff. But we do ask that you try to wash that wound thoroughly with soap and water. If you don't have it, get that water bottle out and really try to get that wound washed up. Second one is seek medical attention immediately. That this is extremely important because we do not know the status of that animal right then and there. So seek medical attention immediately and report the incident to local law enforcement. So if you see anybody in a uniform, you can report it to them. And they'll get the appropriate authorities out there. If you are out on a trail, try to get a GPS if you can. Know where your landmarks are at because we will try to seek that sample from that animal. So I know this is a little bit small for you guys, but I did put the website down on the right and the lower right. But we kind of wanted to go through some algorithms with you guys. And what helps us as public health, USDA, local law enforcement, and hospital determine on whether a patient needs to get that the PEP, so the shots for rabies that everybody speaks of. So if you have some time, click on that link, look through it. It's going to be the whole entire document from Arizona Department of Health Services that walks you through it. It's a very, very good, and I promise it will not bore you. So really get in there and read it. It gives you a lot of good information. And it's gonna make you very knowledgeable, not just for yourself, but for your family, friends, and the community. So I ask that you do look through that a little bit more, and it'll help you. So let's talk a little bit about post-exposure prophylaxis, and that's what we call PEP. So the components of that, of course, are being seen in the emergency room, right? Well, here in Cochise County, PEP is only given in an emergency room. We do not give it at your practitioner's office. It is not given at the health department. You cannot get it at a pharmacy. You must be seen in an emergency room. Outside of the county, of course, you can see any emergency room. But if you would like to be seen somewhere else, you would actually have to call that facility and see if they hold the rabies vaccine and the HRIG that you see there. So what can you expect when you get to that emergency room? Well, immediately they're going to go ahead and ask you questions. They're going to call public health and so forth. They're going to get that wound cleaned, right? They're going to get in there and scrub that wound and get you doctored up. You're going to get an administration of the HRIG right there, and that's one shot. You're going to get that. Then you're going to start the series of rabies vaccines, okay? So those that are not immunosuppressed are going to get one on day 0, day of the bite, right? Day of reporting. Then day 3, 7, and 14. And right below that, you're going to see that someone might need 5 doses, and that is the immunosuppressed patient, okay? So they will have to get one on day 28. That is kind of what you guys can expect when you go to the ER. There's going to be a lot of conversation with public health. the emergency room, the attending physician, and USDA and our animal control, depending on whether it was a domestic animal bite or whether it was a wildlife bite, okay? So that's what you can expect. Put this in here because we wanted to let you know that it is required by Arizona state law to report incidents, okay, to local law enforcement. Whether that is a domestic animal or wildlife, it does not matter. You must report. I did leave that right there in the left, kind of towards the middle, the Arizona Revised Statute. You guys can read into it. It's great, gives you a lot of detail too, and once again, you'll be very knowledgeable. And we are really pushing this throughout the county. That's probably why you're seeing such high numbers too, is because we are really trying to get out there and telling people they must report. So here you go. We wanted to put up 3 years so you guys can kind of see the progression and how it's starting to get higher. So in 2023, you're going to see there, those 3 little dots. Yeah, we got 3 dots there, 3 positive rabid animals, right? Then in 2024, we have a total of 15, and that concludes the year for 2024. 2025, we're already up to 8. And as you can see, it is in that little corner of Cochise County. But this doesn't accurately show all of the positives, okay? These are animals that we were able to capture and get the samples set up to the lab so the lab can test for a negative or a positive. Sometimes animals cannot be caught that bit either a domestic animal or a human. So we were not able to capture them and they were not able to be sent up. Those victims of that bite do have to get the full rabies, that whole PEP that we talked about. So don't be fooled. We have had some this county that we were not able to obtain, and those were additional fox bites. So just keep that in mind. These are not a true reflection because we cannot obtain all those samples. So here's another one. Barb honed in on that. But if you can see down below, we wanted to let you know that this data is as of 3/3/2025. And in 2023, 5% of those confirmed rabid animals were in Cochise County. Then we get to 13% in 2024. And as of right now, we're over pretty much our 50% for our county. So these are scary numbers for us, and we've been really, really trying to push information and get collaboration with other stakeholders. It's been very challenging for us. Here's some other ones. This is a total by species and year. I'm really just going to hone in on 2025 here. If you can see, skunks and foxes are our biggest ones, and they're just really hand in hand. So these are just the positives that hit the lab at the state. Those fox counts are a little bit higher as far as bites go, though. So be aware, be safe out there, and yeah, watch out for these animals. So what have we been doing here at Cochise County and Health and Social Services? Well, we've been posting a lot of social media. We've been getting a lot of response on it too, a lot of shares, word of mouth. Public health preparedness has been to many, many meetings at state level. USDA, we've been bringing in a lot of partners. We've been collaborating with Fort Huachuca as well. Tomorrow we are presenting at Kartchner Caverns along with the state vet to talk a little bit about rabies. So we've really been pushing a lot of material and really trying to talk to people, and it's been an amazing response. It really has, and I think the word is getting out there. Just looking at social media, I mean, it's really been blowing up, and it's been fun though. It's been a lot of fun, but it's unfortunate our numbers are so high. So some real key points on this, just to wrap it up, right? It's preventable. It really is. We just need to maintain vaccinations of our animals, stay away from those wild animals, report once we see abnormal behavior. The biggest one here is rabies is 100% fatal once symptoms start. That's for our domestic pets, that's for wildlife, and that is for humans, very much so. And then for those of you, all animal bites need to be reported to our local law enforcement agencies. So make sure you get the word out for us. And If you guys have any questions, you guys can email me. I can take questions now. If you guys want to have a little bit of discussion, we can do that as well. We have our epidemiologist here and our wonderful medical director, Dr. E, is on the line too.
I'll just jump in. Thank you. What a great presentation. And thank you guys for all the work you're doing around this. I see the posts really regularly. I reshare them, try to get them into other circles that I'm involved in, networks I'm involved in. I live on the San Pedro River on a small farm. We've had 2 incidents with animals that looked like they had rabies and had really quick responses from the sheriff's department and health department. In both of those cases, they had to be disposed, and they came and picked the bodies up. And I just really appreciate it. And you guys are doing great work. Thank you so much.
Thank you.
Any other questions?
No, that was very interesting.
Great. Thank you, Lonnie.
Yes, it was.
All right. So I guess moving on, we have Dr. E. Speaking to measles update.
Yeah.
There he
Hello,
is.
everybody. Thanks for the chance to chat today. I don't have slides, kind of a little more unofficial off the cuff, but I appreciate the time to chat about this today. As I started, kind of refreshing my knowledge as I have to do periodically, the first line in the chapter of an important textbook that I like to read, Preventative Health, or Public Health and Preventive Medicine, the 16th edition, started with, measles is considered perhaps the most infectious disease known to humans. That got my attention early. And going back, measles was first differentiated from smallpox back in the 10th century. So this is a disease we know. This is a disease we know the ins and outs, upside down, backwards, and forwards about. It's been around for a while, and you may also know it by another name called rubeola. So the United States declared measles eradicated in 1997. However, in 2019, there was a big upsurge, and we had 1,282 cases in 2019. 70% plus of those were in New York State. Now, looking at us currently, you may have seen in the popular media and commercial media that there is some measles activity, chiefly in Texas and New Mexico. So my data is, I don't want to call it stale, but it's about a week behind. The federal agencies take a little bit of time to confirm things that happen more local, and they do a lot of due diligence. That's why we run about 7 to 8 days behind, probably the reporters who are really diving on that stuff a little quicker. Currently in 2025, there have been 3 outbreaks thus far. I want to say a statistic, and I'll explain it here in a little bit. 93% of these cases are outbreak associated. And that'll be important when we start talking about this, because these are people with known contacts amongst themselves. These aren't sporadic cases occurring randomly in space and time. These are all clustered together. For reference, there were 16 outbreaks in 2024, and only 69% of them were outbreak associated. So a lot more sporadic incidents. This one is really clustered together in a geographical area, all right? So of these 164 cases, as of February 27th, that were lab confirmed, I have some demographics about them, but 48% of them were in the 5 to 19-year-old age group. 30% of them were under 5 years old. 95% of these cases are unvaccinated. I'm going to say that again. 95% of these cases are unvaccinated. The remaining 5% are people that we would consider under-vaccinated with 2 doses, or 1 dose versus 2 of the MMR. 20% of these cases have been hospitalized. 29% of those people hospitalized are under 5 years of age. At the time of writing this, yesterday afternoon, there was 1 reported death in a school-aged child who was unvaccinated and had no past medical history. So this wasn't a sickly kid. This wasn't an immunocompromised kid. This was a healthy kid, unvaccinated, and died. The last death in the United States was in 2015 in Washington State. And you may have heard Lenny and I were chatting before we began here. Yesterday evening, it was reported that a second death in New Mexico in an unvaccinated adult has occurred as well. So 2024 data, just to kind of contrast, had about 285 cases in the U.S. 89% of those were in unvaccinated patients as well. Now, 40% of those people were hospitalized with complications. Again, following that similar demographic of the age groups we're seeing this year. A little bit about the virus itself. This is a single-stranded RNA virus from the Paramyxoviridae family. I'm glad I said that right. Yay, Eric. This occurs only in humans, unlike rabies, where it can occur in animals and they have a sylvatic reservoir out in the community outside of humans. This is a human-only disease. And it's related cousin to croup and para-influenza viruses. Rashes are tough. You know, I'm a board-certified doctor. Rashes are tough, I think, for anybody outside of pediatricians and dermatologists. So this is why testing is really important to us. We see a rash, we think, okay, it could be one of 15 different things. Testing is really important on this. PCRs and ELISA tests are really important for these. We really want to test to see what the heck this is. That's an important push for us. So how do people get measles? Measles is from contact with respiratory droplets or aerosolized droplets in the air. Now, what's scary about this virus to me is that someone can walk into a room, cough, leave the room. For 2 hours, we have detected measles in the aerosolized droplets in the air after they've left the building. 2 hours. That's a long time. I also wanted to talk really quickly about what we call in epidemiology an R0 value. This is basically the amount of people one person makes sick after they've gotten their illness. So to give you an idea, influenza has an R value of 1 to 2. They typically, if I got sick, I would make 1 or 2 other people sick with influenza. COVID, we may recall, was 1.5 to 2.5 R value, R0 value. The R0 value of measles is 13.2. 13. On average, someone with measles will infect 13 other people. All right. Because of that R0 value, the concept of what we call herd immunity or vaccinating all around that case is around 95%. And you can look and see where the counties fall and where we are with, and where other counties in the country are with their penetration of that vaccine into the community. So the incubation and symptoms are, measles is really, we call it the 3 C's. Cough, coryza, which is runny nose, and conjunctivitis. And he mentioned earlier about wanting to have the shades drawn when he had wild measles as a boy. It affects the respiratory system. It affects the nasal mucosa, runny nose, and the eyes get inflamed and red, conjunctivitis. That usually starts to hit around 8 days after you've been infected. About 2-3 days after your C's develop, your cough, coryza, and conjunctivitis, you get this classic rash. The measles rash is hallmark. It is, for the geeks out there, it is what's called an erythematous, which means red, and maculopapular, which is about the size of the spots, and they're a little bit raised. It has a really cool spread. It is a centrifugal spread. It starts on the head and moves downwards. So if the rash, we're always taught in med school, if it starts on the belly or the arms, probably not measles. Measles starts on the head and moves downwards over the body. I also wanted to mention briefly what are called Koplik spots. These are pathognomonic for measles. These are bluish colored little spots inside the buccal folds of the mouth. But they only occur in about 40% of the cases. But if you see Koplik spots, little bluish bruise-looking marks, that's measles as well. wanted to talk briefly also about complications of measles. Measles encephalitis. This is an inflammation of the brain. This occurs in 1 out of 1,000 people, and usually around 4 to 7 days after the rash begins. About 15%, 1/5, of measles encephalitis patients die. About 30% of people with measles encephalitis have neurological problems. The most tragic one of these, other than death, obviously, is nerve deafness. And prior to the advent of the measles vaccine, around 5 to 10% of all deaf patients in America were due to measles. I also wanted to touch briefly about a long word. I'm going to take a long, deep breath and run at it. Subacute sclerosing panencephalitis, or we just call it SSPE. This can occur 4, 5, even up to 10 years after the initial infection. This is a recurrence of that virus. Hallmark of this is personality changes, abrupt personality changes, seizures, and this unfortunately results in almost always death in these poor patients. So loosely, we are seeing a case fatality rate for measles of about 1 to 3 people in 1,000 cases. In developing nations without care, it is higher. An outbreak in Philadelphia years ago in a religious community there showed 6 deaths in 486 cases. And as I said, in developing nations, that can number between 50 and 100 out of 1,000 cases. There are also long-term effects of measles infection, especially for children. We see those children have difficulty gaining weight and remain low weight throughout their life. And they also are inflicted with immunosuppression, which means for 2 to 3 years after they've had measles, they're much more prone to get other more opportunistic infections. Treatment. There are no treatments for measles. None. We don't have any. Antivirals, ribavirin, oseltamivir, all these things we use to fight flu, remdesivir, none of these work. We wish they did, but they don't. Care is supportive. This is controlling the fever, lots of fluid, and rest. As I like to say, it's stuff Dr. Mom told you when you were in kindergarten. Stay home, rest, take some Tylenol for fevers, and drink a lot of fluids. I wanted to mention vitamin A. Vitamin A given orally to children has been shown very clearly to reduce the severity of illness. If my kids had measles somehow, I would give them vitamin A. The World Health Organization advises vitamin A for all children with acute measles, regardless of where they are. It decreases the severity of the illness. I also wanted to make note that overdosing vitamin A can be incredibly toxic. So be cautious with it. And this is a conversation to have with your physicians. So how do we prevent measles? There's 2 main types of pathways we have to prevent measles. First is what's called passive immunization. This is a mother who has previously had antibodies, whether it be vaccination or wild-type measles, across the placenta to her growing child. She can give protection to the baby. That usually lasts for about 6 months, up to probably no more than a year in that young baby after they're born. The other pathway we have is active immunization. For us, this is vaccines. The first measles vaccine was licensed in the United States in 1963. It wasn't without problems. And in 1968, we saw a swap to different strains of the virus that were being used to create the vaccine. In 1989, the American Council on Immunization Practice, ACIP, switched to advising 2 doses of vaccine. And we'll learn why in a minute, because 2 doses really get you to about 95, 97% of protection. 1 dose leaves you around 93% protected. Vaccine reactions in patients, about 5 to 10% of the patients run a fever. About 12 to 20% of the patients actually have a rash. Okay, and that is your healthy immune system reacting to this vaccine and creating antibodies. The common vaccine that we like to use in the United States is the ubiquitous MMR, which vaccinates against measles, mumps, and rubella, right? Contraindications, people who can't receive the vaccine are people with immunosuppression, HIV patients, AIDS patients, people with immunodeficiency diseases, people that have allergies to vaccine components, mainly preservative antibiotics or eggs, although this is with a lot of exception because we typically like to help them work through that allergy and still vaccinate. We believe enough in this vaccine. Pregnant people are also unable to receive the vaccine. Those people who are lucky enough to be born before 1957, they have presumptively wild type immunity. That means they ran into the virus in their life and they have lifelong immunity to this. I also wanted to mention briefly, as our wonderful leader Barb pointed out, people vaccinated with a specific type of measles vaccine used between 1963 and 1967. That vaccine wasn't as good. We learned more. And that's about less than 5% of the population of America currently. But those people are advised to get a revaccination. They should start and get another vaccine. This is a good conversation to have with your family doctor or your primary care physician. 1 dose of MMR protects 93% against measles. Pretty good. 2 doses gets us to 97%. Now, there's going to be some confliction in the literature. Some say 97, 95, 98. The literature that I personally respect puts it at 97%. That is a hallmark of a wonderful vaccine, and I'm complete. I'm happy for any questions, and I love this stuff, so thank you for indulging me in speaking about one of my favorite topics.
Very good. Thank you.
Yes, sir.
I'll just jump in real quick. Thank you for that report out and share out. Really comprehensive and extremely useful. I'm just curious if you guys are also seeing lots of misinformation getting shared out through random social media, places. And where I live at in Benson, it's a site through Facebook called Benson Chit Chat. I actually don't engage with folks there, but I'm just curious if there are other approaches or ideas or suggestions you have to keep good scientific information in being shared out in the public sphere.
I'm happy to go first, and then I'd love the opinions of others from our team on this call. The internet makes sharing information easy nowadays. That's what's awesome about it. It's important for people to curate their information. Knowledge is power. But you need to look at where you're getting your information from. Are you getting it from your public health department, or are you getting it from Bob down the street? So I would always encourage people to have some diligence and curate their information. There's a lot of misinformation out there. There's the belief that the moon is made of cheese, and people can argue this, and there are websites dedicated to this. Sure, of course. Doesn't make it true. But people can argue for that. There is a lot of miscommunication or inaccuracies being pushed. And this is why we're here. This is what we do. We give good information and good science to the public that's fact and evidence-based. The way to prevent vaccines or the way to prevent measles is with a vaccine. If you want to treat measles, it's supportive care and a little bit of vitamin A taken orally for kids that happen to get sick. That's it. There's a lot of misinformation out there, and like I said, we're the front line on this. We give out the good information.
Barbara, does the department plan on putting any kind of information out on measles? Just sort of a summary. A lot of questions are, should I get a vaccination or not for measles? Where are we on measles? Just So I was just curious if you're going to say or summarize what Dr. McLaughlin has been saying.
Yeah, Lonnie, we have posted a lot on social media. We're referring folks to their doctor, as Dr. E had suggested. We're telling them if they're, born between a certain period to go to their physician and get a titer test, blood test, to see if they do have antibodies, which would justify a booster. So if people want to come in, though, and get the shot, we do have measles available to us. And then as far as dissemination, I know Seth had asked how are we conquering some of the fallacies out there. I've really tried to identify community champions, people in each of these communities that people trust, that work and live and play among folks, like in Douglas, Alex Beneo, who owns Blueberry Cafe, those ground roots champions that can really put forth that public health information to say, trust vaccines, they work, we want to see you healthy, we want to see you live your best life. So it's not just coming from a government entity, because there is a real lack of trust with government right now. And so we're really trying to tap those people in the community that others feel comfortable hearing this messaging from. But yes, we'll continue to put out the measles information on social media. We're continuing to have community champions also disseminate that in flyers and discussions. And then we're also doing outreach. Whenever there's community events or nurses go out, do vaccines and educate. For instance, in Wilcox, Northwest Hospital did a diaper bank. And so we had our nurses right alongside the diaper bank talking about vaccines, giving information, directing people to public health clinics. So we're really trying to take that multi-pronged approach and wrap around. But if you want anything to send out, Lonnie, I'm happy to send you some of our information.
Okay, thank you.
You're welcome.
And this is what's said in the chat.
Yeah, community champions have been super important, and we also tap into our community health workers too, which is also nice. So anything else regarding measles? Thank you, Dr. E. That was a fantastic presentation, really helpful, and like Seth said, very applicable to the times right now. So facility reporting. The good news is we haven't had any incidents or accidents at any of our 5 clinics. So nothing to report, everything status quo. We are hiring a couple nurses. We're hiring a nurse for Douglas, and we're hiring another nurse for Sierra Vista. But other than filling those vacancies, everything is absolutely okay. So good report. Does anybody have any concerns or questions about anything related to public health or anything that was presented today that we can answer?
This is one question that I think
Sure.
has been on my mind there's a lot of turmoil going on in Washington, I might say, in terms of canceling federal contracts and so on and so forth. Are we on the firing line to lose contracts or lose federal funding based on what's happening in Washington?
Yes and no. It's kind of one of those things, it depends. You are accurate. There has been a lot of discussion regarding cutting federal funding. We have a series of grants that have ended. We're not sure if some of those grants are going to be reinstated. It's kind of a wait and see. One of the things that was very worrisome was we lost our USDA representative, and as you heard today, we're having a series of concerns regarding rabies, and they're the people that would eradicate those rabid animals, bring us the body of the animal so that we can get it tested. We take the head and we transport it to the state, and they do brain tissue testing. We only have one USDA representative in Cochise County, and they terminated that individual's position. I was very, very concerned. I talked to my state representatives and I called the governor's office, and I'm happy to report they reinstated him.
Good.
So I was very lucky, and I expressed my absolute concern about rural Arizona, that, you know, we are often the forgotten, and unlike larger areas, we don't have big teams. We have maybe one or two people doing the job of many. So I have to give Governor Katie Hobbs a big thank you, because she came through for us, reinstated that USDA official, and I'm oh so grateful, because now is the time that we really needed him. And he was very emotional about it, and I'm glad that I could help.
Good. Very good.
So we'll have to wait and see as the year progresses what that means for funding for us. As far as county, the health department isn't going anywhere, and I imagine we'll probably do even more if some of our federal counterparts continue to reduce as
Yeah.
far as workforce and so on. And I haven't received anything official from RFK. Nothing's gone out relating to any new mission or vision or anything like that. So we're just staying posted and poised and ready to pivot if we need to, but we're continuing to do our work: health and safety, protection, technical assistance, and support.
Well, keep up the good work.
Thank you. Thank you.
Yeah.
Any other questions or concerns before we part ways?
Yeah, I'll get you Joe Delgado's contact information.
Okay, great. And yes, Seth, that was the gentleman, Al.
He's the gentleman that
Yes.
that came out to our
Yes.
farm twice and was extremely responsive and helpful.
Yes.
It wasn't just about picking up a dead animal. He was shared some of what you guys shared today in the rabies sharing, to kind of educate us about it, because we, you know, it's transferable to horses. We have dogs, we have cats. So I thank you for all the work you do with them and making sure that position's recovered, and it's so important. Thank you.
Yeah, I agree. Absolutely. All right. Well, I will go ahead and adjourn. I'll watch for the information, Lonnie. Thank you all for spending your Friday morning with us. And if you have any
Pleasure.
questions, feel free to follow up. Susan, thank you for joining us. Dr. E and Kim for presenting. And I just appreciate everybody so much, and for continuing to support the health department.
Thank you
You
all.
have a nice weekend.
You too. We'll
Y'all too.
adjourn.
Okay.
Thank you.
Bye-bye.
Bye-bye.
Thank you.